Imagine if yourself, a loved one, or friend was due for an upcoming knee replacement surgery. This situation may not be too unfamiliar as the number of knee replacements in the United States alone is growing at 800,000 and counting per year. The timing, the surgeon, the location, these are all just a few factors that can influence your outcomes, and trying to prepare for the best possible results can be a bit overwhelming. Adding in a robot to assist with the surgery is yet another factor to consider. Myself and an amazing team this summer performed a retrospective analysis of robotic total and unilateral knee replacements, and this study focuses on the patient demographics and outcomes of those surgeries. Introducing the main character of this 1,300 patient study, the CORI robotic system. Pictured here is the team hands-on with the CORI robot on a practice knee. Needless to say, as students, we were starstruck. But does adding in a cool robot automatically equal better outcomes? To help answer this question, we gathered data on each patient that included demographics such as age, gender, and BMI, as well as information on adverse events experienced after the surgery. What we found were 87 documented adverse events, about 6.7% of our total patient sample. While this number does not seem big, when this 6.7% could be yourself, a family member, or even your own patient, it means everything to try to get this risk down to zero. The most experienced adverse event was an MUA, or manipulation under anesthesia, occurring in about 3% of our patient sample. MUA is where the patient has to undergo anesthesia again to move the knee to a degree that would be too painful to do so if awake, all with the goal of helping to restore range of motion and alleviate their pain. Not only does this add to healthcare costs, but it also exposes the patient to another round of anesthesia. Due to the high number of MUAs, we decided to focus on patient demographics related to this particular adverse event. Interestingly enough, 79% of these patients had a BMI over 30 and 72% were female, while the average age of the group was 59. So why are these numbers important? The first goal is that these results can be used to compare to that of non-robotic knee replacements to determine if this robot is truly helping to improve patient outcomes. Next, a goal more close to home would be for surgeons, family doctors, patients, friends, and their family to take these results into consideration when preparing for a knee replacement. Something modifiable before surgery that may improve the outcomes of a total knee replacement is patient BMI. Helping a patient to improve BMI prior to surgery may be the one way you can help them to get the best outcome possible for their knee replacement, especially if the patient is female and around age 59. Helping the patient and their team to take steps to improve BMI prior to a robotic knee replacement may be a huge step towards getting that rate of adverse events all the way down to zero. Thanks for your time.